Hi, everyone, and welcome again for today's event. Thank you so much for joining us. This is the COVID-19 vaccine Q&A targeted for older adults. So if you're joining us for your own personal needs or for family members that you're concerned about, we certainly are glad to have you with us today, and we welcome all of your questions. My name is Shannon Alvord, and I am a part of the Tompkins County Emergency Operations Center's Public Information Team. The Health Department, in collaboration with numerous healthcare providers from across the county, are pleased to present to our community this series of Q&A opportunities regarding the safety and efficacy of the COVID-19 vaccine. While today's event is to focus on vaccine safety concerns, we are joined today by Health Department staff to give a little overview of the registration process. I would encourage everyone, if you have not already done so, to please register for vaccine alerts with either the Swift 911 system that Tompkins County uses. You can get a phone call, text message, email, or you can sign up for the Tompkins County Health Department's vaccine-only email list. I will put links for all of those in the chat box if you would like to sign up for those. Many questions about vaccine distribution can find answers to those questions on the Tompkins County Health Department website. You can also call our wonderful community partners at 211 with additional questions. Okay. While we begin this event, please feel free to submit your questions using the Q&A chat box feature. If you would prefer to ask your question out loud, we will allow time at the end of the session to do so. Please use the raise your hand feature. I will put your name down in order as I see them. We are recording this session to be able to share with others post-event. Please let us know if you would like your question to remain private, and we can remove it from the recording before we post the footage. With that, I'd like to welcome our panelists for today's office hour. We are joined by Karen Bullis from Tompkins County Office for the Aging and the Tompkins County Health Department, as well as Dr. Blake from Cayuga Medical Center. Karen will kick us off with a brief overview of the vaccine registration process, give a little bit of a descriptor of what it's like to get vaccinated at the site here in Ithaca for folks who are able to get registered locally. And if there's questions, we can, throw them into the Q&A and we'll try to answer those here at the beginning of our session. Thank you so much, Karen.
Thank you, Shannon, for having me. I appreciate being here and speaking with all of you. The registration process for the vaccination site, I understand, has been somewhat of a tricky thing for individuals. For the 65 and older population, the pharmacies locally are prioritizing the vaccines for that eligibility group. There are several local pharmacies in our area that you can register with. And all of that information is located on the Health Department website for you to check out. But more to speak to a little bit about the mall site. So for those individuals who are receiving their vaccine up at the mall site, the old Sears building has been completely rearranged to accommodate the vaccines. There is a parking area with plenty of parking for individuals. You enter in and you will go down a hallway and you actually end up in the mall right where the old Sears entrance was. Upon arrival, you will be met with a volunteer who will take your temperature and then she will provide you with a surgical mask for you to wear while you're at the vaccine site. Along after that, you will proceed to the registration where they will actually print out your registration form that you can review. You can make sure that all of the questions answered are correct, and then you will sign that registration form. Throughout each station, there are employees who are there to guide you, answer any questions that you may have. Social distancing is respected, and there is also seating available while you wait. All of the seating is 6 feet apart. Obviously, everybody is masked and all of the employees at the site also wear protective eye equipment. From there, after you fill out your registration, you will be asked to sit and wait. There are, from any given day, I would say 8 to 12 vaccinators on, depending the amount of vaccine that is given. And they are all in their individual stalls, for lack of a better word. So when a vaccinator is ready, you'll actually see them come out with a little green flag, and they will wave that flag, and you will be escorted up into the curtained area. So it is completely private. Once there, the nurse will review with you any precautions that you have, ask you some questions, just to make sure that you are eligible and able to receive the vaccine, and then you will receive the vaccine. After that, depending on certain situations, you'll be asked to wait anywhere from 15 to 30 minutes. Again, you're rerouted into another area where you can sit and wait. Again, 15 minutes. And the reason for that is just to make sure that there are no reactions to the vaccine. They do typically have medical personnel on site in the event that something should happen. But that's the purpose of the waiting, the 15 to 30 minutes. The other piece of that is you will also not leave the vaccine site until you have your second dose scheduled. There will be employees there to assist you with scheduling your next dose. And typically with the Moderna vaccine that we have been receiving, that is 4 weeks from your first dose. So after that 15 minutes is up, you are free to leave, and you will exit out of a different door, but you will end up in the same parking lot that you started with. So it's incredibly convenient. It is handicap accessible. Wheelchairs are available for those who need them. And that's pretty it. Typically, you're not waiting in very long lines. There is seating available. So that if there is a bit of a wait, you can sit and do that comfortably. It really is a great partnership between Cayuga Health Systems and the health department. And, they've really kind of fine-tuned it to be a very smooth operation.
Thank you so much, Karen. That's really helpful. I think we have a question that may be a question for you. Hold on. I'm trying to pull them up. So thanks for the description of what it's like to go to the mall site. Mm-hmm. Folks are wondering, it's been slow go with getting registered locally for the mall site, and what's the current eligibility guidance for getting registered locally when vaccines are available?
Yeah, so the state had come out, and I can't remember the exact date, but it came out and basically stipulated that the local health department was only allowed to administer the 1B vaccine. 1A, which is primarily healthcare workers, is administered through the hospital. And then the pharmacies were told to prioritize the 65 plus population. So that is currently what is happening. So if you are 65 and older, you can register for a vaccine through any of our local pharmacies or any of the state sites. Now, most recently, the eligibility criteria came out that those with comorbidities are also now eligible within the 1B population. The local health department has opted to prioritize individuals age 65 and older with comorbidities, and we are now able to administer the vaccine to that eligibility group. The local health department has decided to prioritize the groups in senior housing at this time, again, due to the limited number of doses that we are receiving that's allocated for this group. This is one of the most efficient ways to get it into the arms of that population. So this week we have started with Titus Towers and McGraw House, and then depending on how the allocation rolls out, we will continue to do that sort of rollout for the time being. Does that answer the question?
Yeah, that's
Okay.
no, that's perfect. And can folks who are interested, who are maybe in this age range, they're waiting to try to get a vaccine at the pharmacy, they've scheduled out for a vaccine in April at a state site, can they sign up on the new Tompkins County Health Department registry list to get notified if they have a space available locally?
They absolutely can. So as I'm sure most of you are probably aware by now, the vaccine registry, excuse me, was just made live today. So this is an exciting new registry that is again located on the Tompkins County Health Department website, where you can go and register your information in this registry. It's not a wait list and it does not guarantee you an appointment. However, what it does do is it provides that information to the county as to who is eligible, what sort of demand there is for each eligibility group, and it will be able to assist us in how we roll out the vaccine going further. So yes, absolutely, I would encourage people to register. I would say that I don't let that prohibit you from either getting the vaccine elsewhere or looking elsewhere for the vaccine, but it is definitely a good thing to do so that we have your information.
Thank you so much, Karen. And
Thank
I've
you.
thrown the link for the new registry form into the chat box as well. Or if you Google the Tompkins County Health Department website, you'll be able to find it there on the homepage too.
Great.
Okay. I am not really seeing any other questions related to registration. So I think at this point, we'll start rolling into some of the more medical questions. So thank you so much, Karen. And at this point, I'll turn it over to you, Dr. Blake. We've got a handful of questions for you today. But first, I'd like you to just introduce yourself, tell us your background, and why did you feel it would be important to be a part of this discussion today?
Hi, thanks for having me. I am a physician here at Cayuga Medical Associates. I'm part of Cayuga Orthopedics, and I've been here for 8 years. Ithaca's been good to me. My patients have been good to me and built me a nice practice here. I do mainly hip and knee reconstruction. So my average age of my patient is definitely 50 and above. So I have a soft spot in my heart for more elderly people. I've always gotten along with elderly patients, and so I gravitated towards that naturally. I'm the medical director here at Cayuga Orthopedics, as well as the medical director of the orthopedic service line for Cayuga Health System. So I have some leadership roles there. And then for this year, 2021, I'm the medical staff president. So when they asked what programs I was interested in taking part in, I immediately said the vaccine. I really do believe in vaccines. I always have. I'm very pro-vaccine. I was just ecstatic when they came out with these vaccines, when the first ones were available, and I feel very strongly about it. So I just wanted to be here, and I'm going to try to get out in the community this year, and I'm going to work on vaccinating people one person at a time. Oh, and my background is I'm from upstate New York, born and bred, from Binghamton area. My husband's parents and my mom are still in Binghamton. We came back to this area because we love our family and we love the people. So.
Great. Well, very glad to have you joining us today. Could you start by giving us a little bit of a kind of an explainer of the vaccine process? What's in these vaccines? What's the research science behind them? Was this vaccine made quickly? Is there anything you could speak to about that?
Well, vaccines have been established for decades now in the world, and certainly we've all heard of vaccines in the past. I do hear people with wariness because of even going back to polio vaccines when people would get polio. So this specific vaccine has no live virus. COVID virus is not in the vaccine, so you cannot catch COVID from the vaccine. It's a messenger RNA vaccine, which I could get very technical and put everyone to sleep right now, but essentially it's a sequence of DNA, rather, a single strand though, that can make it to a cell and instruct the parts of a cell that make proteins to make certain proteins that will help our body fight COVID virus. That's the simplest way, I think, to describe it. You can go into detail and get really into biochemistry with it, but essentially the things to remember are it is not a live virus. It will not give you COVID, and it is not getting into your DNA. It is not new DNA moving into your cells. What else have I been asked? It is not a microchip being moved into your DNA. It is simply a piece of the genetic code of the essentially telling our cells to make proteins to stimulate our immune system to fight this virus. Now, did they come out with this as fast as possible? Of course. We've all watched the news and the tens of thousands of Americans and people around the world, millions that have died. So of course they moved this along as fast as they could. None of us have seen anything like this pandemic, and I'm very, very grateful that they did move it along as fast as they could. But by saying that, I do not feel at all that they rushed it. They went through many clinical trials. Just for New York State, there's a task force to look at this, and that's excluding the FDA and the CDC. So these are major, huge organizations run by the best medical minds our country has that said, yes, distribute this vaccine immediately. So I don't think it was put out fast. I was hoping for it sooner. I do hope the distribution continues to grow and progress so people don't feel that they're left out. Did I forget any part of your question?
No, I think you answered that beautifully. Thank you. It sounds like you speak with full confidence in the vaccine and the process behind it. So thank you for that overview and the explanation of what this vaccine in particular is. That makes it different from other vaccines we may be more familiar with. Can we talk a little bit about common side effects or reactions to the vaccine? What's typical? And Karen shared with us that you do need to stay on site after being vaccinated for 15 to 30 minutes, just in the case of a allergic reaction. Can you speak a little bit to that as well?
Sure. So from what I know about these two vaccines that are available, Pfizer and Moderna, there's no egg product and no latex, which is very important because some of those or similar substances caused a lot of the anaphylactic reactions in prior vaccines. So no eggs, no latex. However, the point of the vaccine, the whole purpose of it is to stimulate your immune response to fight the virus. So therefore, you could see a broad spectrum of symptoms from the vaccine. I personally had two and had nothing other than a sore arm. I would say that's probably the number one thing people will experience. But you could have a full spectrum. You could have fevers, you could have chills, you could have fatigue, you could have a flu-like syndrome. But once again, you have to remind yourself that this is not the COVID virus. This is your immune response actually working, proving that the vaccine is working, and is usually a very self-limited 24 hours. At this point, so many people have been vaccinated. I do know two people that actually had that kind of a syndromic picture. One of my PAs had chills and felt like she had the flu. It was about 24 hours. My mother, who's 72 and not good health, also had some chills and felt ill 24 hours. And she said she kept hearing my voice in her head saying, "This is a good thing." And she wasn't too happy with me, but she got through it because she reminded herself repeatedly that this is the body reacting in the correct way. So it's hard to tell who's going to have no effect whatsoever, who's going to have more severe symptoms. As far as anaphylaxis, if you have had a real, so that's another medical term that is misused, allergy. What is an allergy to something? Nausea is not an allergy. Feeling ill is not an allergy. A true allergy is when you develop, at the very minimum, an itchy rash, and in the extreme stage, itchy throat that leads to a difficulty with breathing. That is what, would be the most dangerous allergic reaction. So you have to remind yourself, if a true allergic reaction is hives and allergy or actual throat edema and difficulty breathing, if you have had that reaction to a vaccine in the past, then yes, you would be high risk for having an anaphylactic reaction, and we would watch you for a full half hour if your doctor determined you were eligible for the vaccine. I think from what I've heard, I was talking with someone that's in charge often at the vaccine site. From what I've been told, the most common reactions have been something called vasovagal. And what that means is someone gets hot and sweaty and feels like they're going to pass out or does pass out. That is also not a true allergy. That can happen for many different reasons. And in my experience, the two top reasons are, one, nervousness, which is very common with everything surrounding COVID. It's natural to be nervous and excited to get your vaccine. And then, you're told to stay inside, and all of a sudden you're in a room with lots of people. So that is natural and it can happen. And then otherwise, you have to remember, you should eat before. You shouldn't go there and wait on an empty stomach. You should wear layers so you don't get too hot. All of these things can add to a vasovagal reaction. So in reality, what they're seeing when watching people for 15 to 30 minutes at the vaccine centers are vasovagal reactions rather than true allergies. And most people with any sort of symptom can have a Benadryl and feel fine. In a more severe scenario, you could get a little bit of epinephrine and be sent to an urgent care or the emergency room. But like I said, the vast majority has really been a vasovagal response, and most likely due to nervousness.
Thank you for that. I think that that's a really helpful, it's helpful to know as you prepare to go for your vaccine. And one of the questions we had received in advance is, are there things that you can do to make the experience more pleasant, or to maybe reduce, the muscle soreness or other things associated with it? And so what you just shared about, making sure you eat beforehand, wearing layers so that you can get undressed for your arm to be out but not too undressed, and also just so that you can be comfortable and given the temperature changes, as well as just doing what you can to relax and trying to get through the experience that has a lot of anxieties around it for multiple reasons. So I think those are good tips. Are there other tips you would share about vaccine comfort or things on that line?
Well, with the muscle soreness, if you're really tense and your muscles tense, I think you tend to, this is just personal experience, have more of a reaction after and longer soreness. I always kind of grab my vaccine and run into surgery, so I don't want to be sore. So I try to relax my muscle as much as possible right before they place it. I have to say, with this COVID vaccine, I felt it was much easier than flu vaccine every year and had less soreness. But like I said, everybody's experience is different.
Sure. We have a question that's come in that's related to similar comment, so I'll answer that one here first. If you don't have symptoms following following your vaccination, does that mean that your immune response has not been triggered? Did you get a dud vaccine?
Not at all. You did not get a dud vaccine. It doesn't mean anything. It means you're lucky.
Have a number of questions about the vaccine in particular. Is there a vaccine, like locally, we've primarily had the Moderna, but there's the possibility that you could receive Pfizer. And then there's the Johnson & Johnson vaccine that will be available at some point. Is there one that has more information about which one may be more safe for the elderly or folks with other health issues? Is that
To my
anything?
knowledge, no. To my knowledge, no. You know, they have testing on each. I don't think there's any glaring differences that I know of. Karen, are you aware of any glaring differences? Yeah, no, I'm not sure. I don't believe so.
Okay, thank you. Maybe you can speak to this with your medical director or president hat on. I didn't catch all your titles. It sounds like you're connected. So there's a question here asking if there's been any outreach to primary care MDs to engage them in this process, this vaccine distribution and vaccine information sharing process.
Information sharing, of course. I mean, our primary care doctors in every community are just the backbone of all medical knowledge and education. So certainly they're a wonderful resource. The truth is, though, that they don't have the vaccine to give out right now. So as physicians, I can speak for all of us when I tell you there's a certain feeling of helplessness when you know patients that really need it, and this computer system that's come out can be so complex. What I can say is my best message would be to be patient and to have faith that over the next few months, everyone that wants the vaccine and in the first level, you know, the 1A and 1B, essentially everyone 65 and older will get it first, should get it first. And it's just going to take some time. But I do completely understand and agree with the frustration. This is just one of those things, like all of COVID over the last year, where I don't think anyone could have predicted this, and planning for it and implementing all the steps is often a moving target. And the reality is it's not perfect, but we're doing the best we can, and we're all going to get to the right place eventually with this vaccine.
Great, thank you so much. There's a question here that I'm worried because I have other medical conditions, and I'm worried about the vaccine, even with hearing things like this.
Mm-hmm.
Is it okay to wait out the vaccine, you know, for the pandemic to be over, or you know, which is more risky, the vaccine or the virus?
So I would tell you that the virus itself is much more dangerous for an elderly person with comorbidities. Like I said, the vaccine, the side effects are not guaranteed, and your normal immune system and a limited amount of time. Where the virus is really, as we've seen, as this has gone on, it's really can be very little symptoms to death. So we know that certain comorbidities increase the risk of death. At first, I think we all hoped it would be like the flu, another flu, but it's clearly not. It's more fatalities, more morbidity. So your risk of death is higher. I will tell you, like I said, my mother, diabetes, high blood pressure, a lot of comorbidities. absolutely 100% wanted my mother to have the vaccine. So if you were my own mother, I would tell you, go get that vaccine, please.
Thank you. Okay, so we do have some questions that are pretty specific about certain medical conditions or certain medications.
Okay.
So, feel free to, if you do not know the answer, it's okay. But I will go through these questions as they come in. So one of the questions is, can I get the COVID vaccine injection if I am on blood thinner medication?
The answer is absolutely yes. Small possibility that you could have increased bleeding at the injection site, but the needle is very small. I've not met anybody that's had a large hematoma, it would be called, or intramuscular bruise. It's a possibility, but I think it's very, very small risk.
Thanks. Sorry, I'm clicking on all these boxes to get to my questions and couldn't find my Zoom box. Okay. The next question, kind of a similar question about medications or conditions. So my concern is about taking steroids in the vaccine. Is there an effect of cortisone shots on COVID vaccine? Would that impact it at all? Does having the cortisone shot in a joint have the same effect as oral medication? Can you talk a little bit about that?
I can give my opinion. I don't believe there are evidence-based randomized controlled studies proving certain things. However, oral steroids or steroids you take by mouth, the pills, if at a high dose every day is a huge difference from what we usually do, 2 milliliters or 2 cc's of a steroid into a joint. So that's a big difference. So with the first group, chronic oral steroids, what steroids do is kind of dampen the immune system. So I would certainly talk to your doctor, your primary care doctor, I would direct you back to, or whoever's prescribing the oral steroids, to say, what are the risks and benefits of stopping these and how long? I mean, I would imagine it'd be 2 weeks before the vaccine, but you'll have to talk to that doctor. Now, as far as the injections into the joint, that I do every day, lots and lots of those. And I've looked it up trying to find some good studies. Both Pfizer and Moderna say wait 2 weeks until 2 weeks after your second dose of vaccine. They give no reasoning behind this. They give no evidence-based medicine behind this. So I've been presenting that to my patients, and the majority of them go ahead with the injection. I know of 0 side effects from this. Most of the time when you put an injection into a joint, it is contained there. Now, you will hear people that say their blood sugar spikes or they have systemic, flushing, or they feel hot. So there are systemic side effects that have been reported, but it's very, very rare. So I would imagine that is much less of a chance of having a cross reaction with the vaccine than chronically taking a large dose oral steroid.
Thank you. Much appreciate, understanding the studies and things that have come out. So
yeah,
thank you.
Sure.
Another question, similar line of questioning. So I'm going to try to pronounce this correctly. There's a autoimmune system disorder that
Guillain-Barré.
Okay, that's the one. So they've been told as a result of that not to receive flu vaccinations. Does the COVID-19 vaccine have a similar concern?
So I did try to read on this, and I found again and again on the internet, mind you, everyone saying that the same thing, that you could indeed have the COVID vaccine with Guillain-Barré in your history. Some of the side effects of the flu vaccine in the past mimicked Guillain-Barré. That made people nervous. All of the science behind it, I'm not quite clear on, other than I think it goes back to Guillain-Barré is such a devastating illness that no one wants the chance of having that again. So as far as the COVID vaccine, there are no contraindications that I know of for patients with Guillain-Barré. Once again, I would speak with your primary care physician about it. The across the board contraindication for the COVID vaccine, the only things I could find that were repeatedly set in stone were one, prior anaphylactic reaction, and we discussed that already, throat swelling, difficulty breathing. Two, an immunocompromised state, like someone in the throes of chemotherapy without any white blood cells in their body, something really, a devastating time in their health. And three, children under 16. So those are the contraindications that I know of.
Okay. There's another question, a similar autoimmune question, just about, has lupus been mentioned at all? Is that similar to just speak with your primary care a little bit more closely about that?
I would say speak with your primary care about that, just to review the lay of the land with your immune system. But I would hypothesize that your doctor's going to tell you having lupus is more of a reason to have the vaccine.
Thank you. A question about if they take a medication for depression, is that okay? Has that come up as a concern?
I haven't seen any concerns about psychiatric medications, and I would certainly tell people to continue those and to go get the vaccine.
Great, thank you.
Sure.
I'm going to give you a slight break, Dr. Blake, and turn it back to Karen for a minute. We've had a question come up in the Q&A. Just wondering, the question asked specifically, what is the date and time the vaccine is happening for us in Ithaca? So I'm wondering if you can maybe just give us a little explainer again, what you shared in case this person was not able to join us in the beginning, about how and where to get vaccinated locally.
Yeah, of course. Yeah. And that's the big question on everybody's mind. And we absolutely understand that. Again, so as far as individuals aged 65 and older, the state had come out and mandated that the local health departments prioritize their vaccine to the 1B eligibility groups. And that the local pharmacies are the ones to prioritize the age 65 and older population. So if you are 65 and older, you can register for a vaccine at any of the local pharmacies. Again, the pharmacies that are providing it, the information is on the health department website that I believe Shannon has put in the chat. Then most recent, and of course, those individuals are also eligible at any of the state sites. The closest two would be Binghamton and Syracuse. Just recently, they opened it up to those with comorbidities. And again, the local health department is prioritizing age 65 and older with comorbidities. Furthermore, they're prioritizing those groups within senior housing complex at this point. The reason behind that is, again, because the doses that we are allocated weekly, and we never know from week to week how many doses we will be receiving, because those doses have been so small, instead of opening it up to, tens of thousands of people, we have decided to prioritize groups to get a bulk group done in senior housings. And we will more than likely continue down that route, again, depending on the vaccine supply that we receive. That is a lot of information. The other piece is that, just recently today, we have opened up the registry, the vaccine registry for individuals to sign up. Again, that link is in the chat. Thank you, Shannon. And what that is you can enter in your information. It asks you some demographic information, and it asks you your eligibility. So by doing that, it does not necessarily guarantee you an appointment, but what it does is it allows the county to collect the information so that as more vaccine becomes available, we can open it up to these groups and actually contact you when doses are available.
Thank you so much for sharing that with us again. And I hope that answered your question to the participant who asked that question. I have put all of the registration links back into the chat box. And we had a comment come through that from someone who has signed up for those alerts, and they shared that they work, that they got an alert and were able to sign up and get an appointment for a vaccine. So please do sign up for those alerts if you're able to, or sign up on behalf of someone if that is your situation. The registry list, you can sign up people, you can sign up your family members, you can sign up people that you're connected to who might not be able to access it online themselves, or you can call 211 and they can help you with that process at least.
And Shannon, I'll just add one more thing about the registry, if I could.
Sure.
One of the nice things about the registry is we've been hearing a lot, obviously, about the online registration and how that's not feasible for everybody, especially older adults who may not have access to computers, internet access, things like that. If you sign up for this registry and you don't have computer access, that's okay. When you do become eligible for the vaccine, you'll receive a phone call, either from probably folks in 211 or my office, the Office for the Aging, to help then register you for your vaccine appointment.
Thank you. Okay. And you're hearing it first. This is like hot off the press stuff. So thanks, Karen, for being able to explain that to us all, myself included. Okay, our questions are going back to you, Dr. Blake. I have already had the COVID virus. Should I still get vaccinated?
Yes, you should still be vaccinated. We're unsure, and I think it's different for everyone, how long the immunity lasts after the virus. I don't think it's clear cut. I think it's different for everyone. What I don't know is how long after they recommend. So that I would need to look into further. They might say, wait 2 months or wait only 2 weeks. I'm just not sure.
Great, thank you. And just trying to understand a little bit more about the vaccine and what the vaccine does. So once vaccinated, it will lessen my symptoms if I catch the virus? Can I have the virus then and not know it and pass it on to others?
So the answer is yes. Once you've had the vaccine, you can still catch COVID. But the hope is that because your immune system has essentially, prepared for the virus, that your symptoms would be much less severe, and that your risk of the worst symptoms, such as death, would be much lower. So protecting yourself from the worst of it, rather than a magic pill that, saying you'll never contract it.
So after we get vaccinated, is it still important to wear masks and distance yourself from others? Should those measures still continue? Absolutely,
because that really is about the spread of it, right? We're not able to completely make it disappear. So the ways we fight it is by not spreading it, and that is the social distancing and the masks. And then we also fight it by protecting ourselves with the vaccine so that people have less symptoms and less chance of death.
Thank you. We're approaching the end. Okay. Here's one last question about the vaccine and the variant. Is that something, do we know anything about the vaccine and its effectiveness with the COVID variants?
I know very little about that. I don't think we can guarantee at this time that the vaccine helps with COVID variant. But I would think that even though it's a variant, to have some immune system reaction ahead of time would be helpful. So I think it's promising that you could have some sort of protection to lessen symptoms, but I don't think we know that the vaccines we have now protect us against the variant, unfortunately.
Right. I will fix you. I think, I'm not seeing any more questions come in over the Q&A, and I think we've gotten through most of the questions that were on our list already. So Dr. Blake, in closing, is there anything else you would like to share?
Just that if you have anxiety or questions about the vaccine, I would certainly direct you to the doctors that you know and trust. And I think they'll be happy to talk to you about it. So reach out to them. And once again, go get that vaccine.
Great. Well, thank you. I'm not seeing any more questions, so I think we can wrap it up and give everyone a couple minutes back to their day. I'd like to thank everyone for joining us today for your really great questions. I think both Karen and Dr. Blake spoke to a real sense of unknown and uncertainty about this whole process and the experience that we've all been through together for this past year. It's really fueling a lot of anxieties about the vaccine itself, about the process. And, just please stay tuned into the Tompkins County Health Department for updates. Sign up for those alerts so that you can kind of relax on checking websites constantly for updates. We will contact you through those systems that we have in place to do so. Thanks again for joining us. And, if you have any questions, you can submit those through email as well to the COVID-19 vaccine email. I'll throw that into the chat. And stay safe, be well, take care, and thank you so much for joining us today. Thank you, Dr. Blake, and thank you, Karen, as well.